My name is Thomas Leader, MD. I'm an orthopedic surgeon in practice with Town Center Orthopaedics. Our main office is in Reston, and that's where I spend most of my time. And I've been in practice for roughly 30 years. I'm the founding member of this practice, and I'm excited that our practice has grown to such an extent, and we cover a range of specialties. My personal specialties are shoulder, hip, and knee problems, and I deal with these on a regular basis, both operatively and non-operatively. The AC joint, otherwise known as the acromioclavicular joint, is the very end of the collarbone. So it's right at the top of your shoulder. Most people can feel a little bump and a little separation. It's the junction between the clavicle and or the collarbone and the top of the shoulder blade. The other bone is called the acromion, and that joint is the source of a range of shoulder problems. You should see a doctor when there is an acute injury to the AC joint. A common way that AC joint problems develop acutely is a fall directly on the shoulder, such as a football player that's tackled, or someone falling directly off on their shoulder from a bicycle injury. And so any acute change in AC joint pain should be addressed by a physician. And additionally, patients can develop long-standing problems that can begin gradually. And if this problem is significant and lasts a long time, it is worth having an orthopedic surgeon address this problem. So many AC joint injuries ultimately do not present in long-term problems. However, a few separations where the bone does not meet congruently can develop into arthritis. In that case, the joint can become irregular, swollen, and painful. There are a couple of treatment options for these. Sometimes anti-inflammatory medications such as Motrin or that type of medication is useful. In other occasions, we'll use cortisone, anti-inflammatory injections into the joint. And finally, there are surgical options that come up occasionally. And in that situation, generally it requires excision of the joint. This is one of the few joints in the body that can be excised without long-term consequences and is very effective at alleviating long-term AC joint pain produced by arthritis. An AC joint separation typically occurs from a fall directly on the shoulder. Two common scenarios are one where someone falls off of a bicycle directly on their shoulder, driving the shoulder joint down. And a second injury would be a football player who falls directly on his shoulder, injuring or separating that joint. Commonly, when there's a shoulder separation, there'll be a prominence at the end of the collarbone that'll ride up because the ligaments around the end of the collarbone are torn or separated. A shoulder separation should not be confused with a shoulder dislocation where the actual ball part of the shoulder joint pops out of the socket. Most AC joint injuries are treated non-operatively. That generally means symptomatic treatment. In most cases, that means placing the shoulder in a sling until the symptoms allow early mobility of the shoulder. And generally, the majority of shoulder separations become symptom-free in 6 to 8 weeks. AC joint surgery is required or recommended when there is a large injury to the shoulder. That means that the end of the collarbone has ridden way up, there's a large bump, or that other ligaments around the shoulder are separated or torn, and there's a significant amount of disability. This is a pretty small percentage of all AC joint injuries require surgery.